Hello everyone, my name is Marshall. Today I want to talk about the impact of inadequate skill mix in the aged care settings. The aged care settings I mentioned in this PowerPoint is mainly within the residential aged care facility, which is just nursing homes. I'll be using both terms interchangeably. The intended audience is the new grad RN. This presentation can also be presented to ENs or AINs, NOMs or TLs. Because the audience are mainly in nursing professions, I won't be explaining the abbreviations and jargons in this presentation. So, nursing skills mix often refers to the number of registered or unregistered nurses with various qualifications and clinical expertise that are assigned in a particular healthcare settings or ward. A rich skill mix occurs when there is more RN than the number of EN or AIN. But this is not always the case. I remember when I was working as an AIN in a hospital one morning, during the handover, the team leader discreetly complained about having too much new grad nurses working with her in that shift. So even though the skill mix was quantitatively rich during that shift, it wasn't qualitatively rich. To put it in a simple term, the RN's levels of experience should also be considered too. In this section, I use my personal experience to relate to the nursing issue I'm presenting. It will engage the target audience more. It is estimated that over 65-year-old population in 2012 is 14% and will be increasing to 19% in 2031. The over 85-year-old population, who are the main consumer of RACF, will be twice as much. In 2015, Australian Institute of Health and Welfare reported that the number of people using aged care service had been increased by 63% since 2002. In fact, data reported by Australian Nursing and Midwifery Federation showed that composition of RACF health professions tend to be more personal care workers than the RNs. If you look at the table on the right-hand corner, all the statistics that I used here are showing my audience that the population is aging and the demand of nursing home is increasing. The table reveals that skill mix in nursing home tend to be inadequate as there are not enough RNs. Consequently, nurses are being forced to work with inadequate skills mix, leading to avoidable mortality and injuries. The study has shown that the skill mix has an inverse relationship with the patient outcome, particularly in terms of falls prevention, urinary tract infection, pressure ulcer. The inadequate skill mix also has been allegedly linked to the nurses abandoning the health profession, and thus it compromised the health of the entire community. It is found that 31% of the new grad RNs who left their first jobs within the first 2 years of nursing. Among those people, 73% of them revealed that they did not receive guidance to fill the gaps in practice. Again, I used the research article and the statistics to prove to my audience that the poor skill mix can have negative impact on both the patient outcome and the health of the workplace. This is especially problematic as there is currently no available policies or guidelines in relation to RACF's nursing skills mix and staffing in Australia. Additionally, the only two associated standards that were set by the Australian Aged Care Quality Agency during accreditation process did not specify either the number or the skill mix of the staff required. In comparison, the federal staffing standards for American nursing home is 1 RN for 8 continuous hours for 7 days a week, and a licensed staff member including RN, EN, or AIN equivalent for the remaining shift. As the current inadequate skills mix in nursing home is failing to deliver safe, quality aged care service, The Australian Nursing and Midwifery Federation, in conjunction with other concerned parties, have released a report called National Aged Care Staffing and Skill Mix Project. This report aims to urge the establishment of a staffing methodology that can consider both staffing levels and the skill mix of the nursing homes. The report has concluded that to ensure safe nursing care is delivered in nursing homes, a minimal skill mix of 30% of RN, 20% of EN, and 50% of ARN or PCW is required. So how can effective leadership resolve this issue? Well, effective leadership can provide the correct patient allocation based on patient acuity, qualifications levels, and the years of nursing experiences. It has been approved that good skill mix can improve patient outcome, such as falls, pressure ulcers, infection control, community-acquired pneumonia. Financially speaking, having a good skill mix is proven to be more cost-effective. In addition, effective leadership that provides support, guidance, mentorship to the less experienced RN. This is especially important for RN who have just started their career. Bay ETL believe that the safety and quality of the nursing team depends on the components of the team working environment, such as mutual support. The team working environment and adequate staffing levels and skills mix can ultimately prevent missing nursing care. As a new grad RN, when it comes to dealing with inadequate skills mix, what are my responsibilities? First of all, developing your own clinical expertise is essential. It obviously will take time to gain experience, but there are some approaches that we can use to facilitate this process. For example, we should always try to reflect on our practice. Cardwell and Grobel has pointed out that reflecting on and in action improve nursing practice and ultimately improve patient outcome. As new grad RN, referring back to policies and guidelines and evidence-based practice can also help us to develop a professional and a safe practice routine. In fact, the Nursing and Midwifery Board of Australia had mandated the minimal CPD hours for RNs at 20 hours per year. In the meantime, we should also actively seek for mentorship or guidance in workplace. Researchers have indicated that new grads who receive mentorship and guidance during their first year of nursing are more likely to stay in their profession. So let's assume if poor skills mix allocation does occur, then having the moral courage to stand up for yourself and for patients is crucial for new grad RN as well. The Commonwealth Aged Care Act 1997 has already established that the residents should rightfully expect their care and needs being met adequately, and there should be a number of appropriately skilled health professionals to meet the residents' demands. Additionally, codes of ethics for nurses in Australia also determines that valuing culture of safety in nursing and healthcare is essential for RN. Therefore, as a graduate RN, recognizing that a poor skills mix in nursing home is both legal and a moral obligation. Another expected responsibility to prevent poor skills mix is developing nursing leadership skills. It has been found that the first 10 years of RN is the ideal time to develop their leadership skills. Research also indicates that new grad RN who experience successful developmental program often translate into successful nursing leadership career. Developing such skill gives new grad RN an opportunity to develop their ability to lead and coordinate within a multidisciplinary health team, where they can not only facilitate the teamwork among different health team professionals, but also can assist residents to make informed decisions regarding treatment options or end-of-life care. Again, in this section, I have used study, policies, report, and legislation to illustrate the importance of having those expected new grad RN responsibilities in terms of preventing or overcoming poor skills mix. The use of graph draws audience attention too. In conclusion, poor skills mix is a problem that can negatively affect both patient outcome and a healthy workplace in terms of reducing RN retention in the ICF. Governing body need to set standards and staffing and skills mix. As a new grad RN, we should be able to recognize that this problem does exist in the workplace and be familiar with all the expected responsibilities to overcome this problem. Thank you.